5, 4, 3, 2.
Hi everybody, and thank you for joining us today. I'm here with Lucy Postolov, licensed acupuncturist and herbologist. Lucy's going to share with you a few questions that come up very commonly in her practice. Lucy, can you briefly explain how acupuncture works?
Sure. From Chinese point of view, acupuncture works in the following way. The human body has not only the blood system, endocrine system, nerve system, and other systems. It has also a system of channels and meridians, and a special energy called qi circulates there. So when we insert a very thin needles in human body, and I'm going to use this acupuncture model, what we do, we are moving the energy in channels and meridians and create the balance in the system. From Western point of view, it works in a different way. When we apply the needle in human body, it creates the chain of reaction. It moves from the skin to central nervous system, through the spine, into brain, thalamus, hypothalamus, and sends the signal back. That is how neurotransmitters are released in the body and a certain work is achieved.
Lucy, a lot of people are confused about the difference between acupuncture and acupressure. Can you tell us the difference, please?
Of course. What I did right now is called acupuncture. We insert very thin needles in the human body. Acupressure is where we do not penetrate the skin, where we just press at a specific points. That's the difference. Pressure versus puncture.
Okay. Now, I don't have that much time to devote to a treatment. How long does a treatment take?
On average, treatments last from 25 to 35 minutes, but my intake of the first patient about an hour and a half, because I studied the whole medical history of the patient, the family history of the patient, and then I use the acupuncture. On the follow-up session, I usually just check the pulse, the tongue, which is the base of Chinese diagnosis, and then do the treatment. The treatment just with the needle itself is about 30-35 minutes. Depends on patient's need.
I did a little research before I wanted to have this interview with you. What does acupuncture treat?
According to World Health Organization, acupuncture can be helpful with 140 different conditions. I will not name all of them. I'm going to name most common. Acupuncture can be very helpful for cancer patients who go through chemotherapy, radiation, and surgery procedure. Acupuncture is wonderful for migraine, headaches, low back pain, neck pain, joint pain, infertility, asthma, allergy, cold, flu, impotence, and many, many other conditions.
How about for children, Lucy?
It's one of the most favorite work I do, working with kids. It's so rewarding because they respond to acupuncture very easily. They don't have the baggage and luggage we adults have, and it's beautiful how wonderful they quickly respond.
I know children don't have much of a tolerance for pain. Actually, I don't either. Does it hurt?
Acupuncture does not hurt. As you notice, the needles are as thin as human hair. I don't know if you can see it on camera. When I work with kids, I usually use even thinner gauge of the needle, and I also use special gold 24-karat covered plated gold beads, which I apply on child's body.
And finally, Lucy, what's the first thing you do when you have a patient come into the room? How do you diagnose with Chinese medicine?
Chinese diagnosis is very different than Western diagnosis, but it is incredibly accurate. So what we do, we check a pulse of the patient in 6 different positions on each hand. And we do it not with one thumb like we do it in Western medicine. We do it with 3 thumbs, and it gives us information about 12 organs and meridians. Another tool is I'm asking a patient to show the tongue, and the tongue could have different color, different coat, different shape, different cracks, different teeth marks, and that all tells us a story. Very often I see the condition and disease before the Western medical doctor does. So many times in my life I would refer a patient to a doctor asking to do MRI of certain area, and the doctor would call me 3 days later and tell me, how did you know that this patient actually have cancer? We didn't see anything. It was no symptoms. And I was able to see the alarming signs way before they did MRI or way before patient had complaints.
All right. Well, for more information, please visit Lucy at www.lucypostolov.com. You can also find her on Facebook and Twitter, and her email address, lucypostolov@gmail.com. Lucy, thank you for your time.
Thank you so much. Be well and healthy.